December is here, meaning the holiday season is in full swing, and for many of us, that also means that we like to enjoy a drink or two.
That's right. But of course, drink responsibly, but also think about what you're doing, what you're drinking, because it can affect your heart. Chief of Cardiology at St. Joseph's Health, Dr. Russell Silverman joins us this morning, along with Heart Health Academy's Andrea Atcheson. Good morning.
Good morning, ladies.
Thank you so much for joining us.
Thank
now,
you.
I feel like you're about to dampen our spirits here, because you can't tell me that, you know, we have to drink during the holidays. Are you saying don't drink during the holidays?
You know, I'm not going to sit here and say that. Of course, we talked a little bit about, you know, overindulging last month when
Right.
it came in play with heart failure. Tonight or today, we're talking about alcohol a little bit and how it affects the heart. So there's a syndrome called the holiday heart syndrome that we just wanted to touch upon. And it doesn't mean anything good like emotional heart. It's actually something that you don't want. And it has to do with, the medical literature actually found this back in 1978, so it's been around for a while. It has to do with doctors finding the increased prevalence of cardiac rhythm disorders around the holidays, which are related to binge drinking.
Well, and I think, Dr. Silverman, a reason for that too is the holidays are hard for some people. Others, they just enjoy a drink or two, right? But this could have some serious effects.
Yeah, so we're not here to judge. We're just here to
Right.
tell you what can happen to you. So holiday heart syndrome, as Andrea just mentioned, is a real syndrome. It occurs in about 60% of patients who are people who binge drink on the holidays, using that as an excuse to overindulge.
When you say like binge drink, can we define that a little bit? I mean, are you saying like getting like wasted, you know, or intoxicated to the point of like blackout? Like, what is that?
Well, that would be the extreme.
Okay.
But a binge is different for a man and a woman. A binge for a man is about 5 alcoholic drinks over the period of a evening or night.
Okay.
And a woman, it's 4.
Okay.
Oh, okay.
So, you know, the content of alcohol,
I'm all right then.
yeah, you just shouldn't drive after you've had
Yes,
it. But,
yeah.
So I can throw that in
but
there.
you know,
Yeah.
the percentage of alcohol in a drink is different around the world. So I'll just take a second. In Europe, in England, for instance, an alcoholic drink is about 8 grams of alcohol. That would be a shot in England. And in the United States, it's 14 grams. And in Japan, it's almost 20 grams. So if you really want to have one, go to Japan, because you'll end up having 1.5. But in this country, we recommend moderation, of course. There's health issues, and the overindulgence of alcohol increases emergency room visits and aggravates rhythm disturbances that may already be there or bring out rhythm disturbances, in particular atrial fibrillation, that is common when in 60% of people who binge drink or overindulge on the holidays.
Well, and speaking of, Andrea, you have a glass there with this, so you're going to pour what a typical glass of wine should look
Exactly.
like.
And if you look at this glass, you know, to me, this is a big glass of wine, meaning the glass itself. However, this is about 4 to 5 ounces of wine, and I planned that appropriately.
Right.
This is it, but when you go to a party or you're at a restaurant perhaps and you have an open bottle of wine, maybe you have somebody serving it, you might not get done with this, and all of a sudden they're coming around and filling it up again. So you're constantly getting more wine. You don't know exactly how much you're drinking, for example, or it could be beer, you know, or spirits as well. But then all of a sudden you're not feeling well, and holiday heart syndrome people tend to get palpitations or flutters in their heart. And that means, you know, you better slow down. And if it's associated with any other symptoms such as dizziness or loss of consciousness, chest pain, you know, you definitely need to get medical attention.
Okay. Oh, geez. Okay. You can still drink responsibly and have a good time, though. That's what we should say, right? Yeah.
Yes.
Listen, Andrea Atcheson is a physician assistant, wellness coach, and chef. And if you would like her help or more information, you could visit thehearthealthacademy.com.
Thank you. Less is more in this situation.
Yeah.
Yes, be careful, responsible, and don't drive, drink and drive.
Yes.
Thank you.